Welcome to Pine Ridge, a reservation home to 25,000 natives in South Dakota. This video will cover the history of Pine Ridge and how it functions today. It will discuss socioeconomic status of the reservation, as well as organizations that are helping the tribe. Lastly, it will cover current issues at Pine Ridge and suggest some policies to address these problems.
The terms of the Fort Laramie Treaty of 1868 placed the Lakota on one large reservation that stretched across parts of North Dakota, South Dakota, and 4 other states. After the defeat of the Indian tribes during the Indian Wars of the 1870s, the United States created several smaller reservations. In 1889, the government confiscated 7.7 million acres of the Sioux Sacred Black Hills and assigned the Ogallala to live on the Pine Ridge Reservation, which occupied 2.7 million acres. In 1890, government troops senselessly slaughtered over 300 reservation residents, most of which were elders, women and children, and it was near Wounded Knee Creek. In the 20th century, the U.S. Supreme Court ordered the federal government to pay the Sioux tribes millions of dollars in compensation for illegally confiscating the Black Hills. The Ogallala remained strong in their desire to have the Black Hills returned to them and refused to accept settlement money. The Pine Ridge Reservation has been designated as one of the poorest areas in the United States. The reservation has few natural resources and no industry. Many residents travel more than 120 miles to Rapid City for seasonal employment. Tribal and federal governments provide the few jobs that are available on the reservation. Only 1 Ogallala in 5 has a job. Medical care on the reservation is inadequate, and many tribal members forego medical attention because of the long distance to medical facilities. In addition, housing on the reservation also does not meet the tribal members' needs. A severe housing shortage forces hundreds into homelessness, while thousands of others live in overcrowded, substandard accommodations.
Pine Ridge is often called the poorest place in America. Its economic stagnation and its lack of resources has caused its people to suffer. The reservation does not have much economic development. People annually receive $80 million from the government, but this money is spent towards stores located off the reservation, so it hardly benefits the tribe. The tribe also makes some money from tourism, but not much. The casino also helps the economy, employing 250 individuals. Money also comes in from agriculture. In 2002, the USDA said there was $33 million from agriculture production on Pine Ridge. However, less than 1/3 of the income went to tribe members. Most employment is provided by community institutions. Therefore, there are many organizations that are working to help the people of Pine Ridge. Like many Indian reservations, most of Pine Ridge is below the national average for socioeconomic status. The average household income in the U.S. is $51,000, but at Pine Ridge it's only $28,000. 26% of the reservation has an income less than $15,000, and no one has a household income greater than $250,000.
The Pine Ridge Reservation is home to the Oglala Sioux tribe. It is organized in a unique way. The Pine Ridge Reservation is organized into 9 districts: Eagleness, La Creek, Medicine Root, Pass Creek, Pine Ridge, Porcupine, Wakpumni, Akla, La, and Wounded Knee. Each district elects 2 representatives who serve as the tribal council. The executive committee consists of a president, vice president, treasurer, secretary, and a 5th member. All positions serve 2-year terms. The Tribal Council will select the Secretary and Treasurer. One of the main organizations that support this reservation is the Remember Organization. The Remember Organization is a non-profit organization that works with Oglala Lakota Nation on the reservation. The purpose of this organization is to improve the quality of reservation life by building relationships, sharing resources, and volunteer services. The Remember organization is not the only organization that works to improve the quality of life on the Pine Ridge Reservation. There are other organizations such as the OST Partnership for Housing. This is a nonprofit organization that works to establish and address house shortage on the reservation. Their goal is to improve living conditions while still maintaining affordable mortgages. Another organization that works to improve life on the reservation is the Pine Ridge Area Chamber of Commerce. This is a voluntary nonprofit corporation whose purpose is to maintain and improve Indian-owned businesses.
According to Remember, the rate of alcoholism on the reservation is 80%, which is ironic seeing as alcohol is prohibited on the reservation. It has been reported by the Medicine Wheel healing community that kids begin drinking at ages as early as 9 years old because it is so normal now. Parents aren't able to support their own children due to addictions to alcohol and other substances, leaving children with high chances of becoming alcoholics themselves, dropping out of school, becoming a pregnant teenager, unemployed later down the line, and are committing suicide. Children with parents who are alcoholics have a 1 in 4 chance of being born with fetal alcohol syndrome and being a victim of child abuse. There's a town outside of the reservation called White Clay. The reservation itself is in South Dakota, but it is right on the South Dakota-Nebraska border. White Clay is in Nebraska. This town is comprised of 1 block, 10 residents, and 4 liquor stores. White Clay alone is said to sell 4.9 million cans of beer a year, according to the Nebraska Liquor Commission. There has been much controversy lately about the consequences this town's high sales of alcohol have on the Ogallala Lakota community. The people on the reservation are beginning to take a stand against the sale of liquor in White Clay because of the severely detrimental effects it has on the people of the reservation. The Lakota people are protesting, blockading, using litigation and civil disobedience in order to have their voices heard. They stand strong, fighting for the sale of liquor to stop immediately. The issue is that since the alcohol is being sold in Nebraska, it is legal, and Nebraska wants the tax money, so the state government isn't doing anything to stop the sales either. The Lakota people, on the other hand, view it as a violation of their human rights to health. With alcoholism so rampant, which clearly stops the victims from being able to enjoy their well-being, the sales of liquor need to stop so that alcoholism rates can go down. This issue is still going on today, and it is growing. Another huge issue going on is lack of access to health care on the reservation. The life expectancy on the reservation is the second lowest in the Western Hemisphere, only behind Haiti. The reason for this is because diseases that would be completely avoidable and preventable, or at least manageable in other parts of the United States, are fatal on the Pine Ridge Indian Reservation. Statistics say that diabetes is 8 times what the U.S. rate is, cervical cancer is 5 times the U.S. rate, there's twice as much heart disease, and 8 times as much tuberculosis on the reservation as there is in other parts of the United States. Their right to health care and health is being denied, and the people are the ones paying the price. These are completely avoidable deaths. Measures need to be taken immediately to change this pattern of ignoring this group of people's rights solely due to their inability to afford the expensive mainstream medication that is needed to prevent disease.
In young children, malnutrition leads to brain development problems and can cause behavioral issues and issues with paying attention. This directly or indirectly contributes to the high dropout rate of schools on the reservation. We suggest that if officials of the reservation reach out to non-governmental organizations such as Partners in Health to help improve the quality of food that children consume by putting healthier foods in stores and selling them at more affordable prices, this will promote the people of the reservation to lead healthier lives, which in the long run will help the economy of the reservation and will improve the overall standard of living for individuals.
Another solution that we suggest is creating programs and facilities that alcoholics on the reservation can utilize to get help with their addictions. This will create an outlet for those who want to change their ways, but prior to the creation of these facilities were not able to do so. This would help lower the absurdly high alcoholic rates on the reservation, but would also create a larger workforce and give back part of the culture of the Ogallala Lakota people that has been taken away due to the rampant alcoholism on the reservation.